This October, WUSA 9 is celebrating 20 years of Project 9 and our commitment to helping women beat breast cancer. As part of this celebration, we are partnering with FORCE, which stands for Facing Our Risk of Cancer Empowered. FORCE represents women who've inherited an unusually high risk of breast and ovarian cancer. And Anita Brickman introduces us to one of its members and her surgical journey.
Caroline and Alan Prout have been married 1 year and this summer traveled on a romantic vacation across Europe. But what they're dealing with now is something few newlyweds face. That trip was a final getaway before Caroline, age 28, undergoes a prophylactic double mastectomy.
My mother was diagnosed with breast cancer January 2012. She found out she had triple negative breast cancer.
She and Caroline also now know they both carry the BRCA breast cancer gene mutation. As women of Ashkenazi Jewish descent, they are at higher risk for this mutation, which can raise the risk of developing breast cancer to 85%.
I was definitely hoping I wasn't. I think anyone would be. And it was hard.
Caroline originally planned to get extra mammograms and other screenings until she and Alan could have a family and she could breastfeed her children. But her very first test revealed 2 suspicious areas that warranted biopsies. Even though the biopsies came back benign, fast-growing cells were spotted, and Caroline decided to radically change course.
I thought, I don't want to keep doing, getting monitored, then going through the week of waiting after you have a biopsy. That week's horrible.
So instead of waiting, Caroline is taking action and scheduled for a combination mastectomy and reconstructive surgery. Dr. Shauna Willey is a surgical oncologist who will perform the first part of the procedure at MedStar Georgetown University Hospital.
We leave as much skin as we can leave nipples, and I take out the breast tissue, trying to preserve the health of the skin that's left behind.
On the morning of the surgery, Caroline seems calm and confident in her decision.
So after today, this will be behind me. So it'll be wonderful.
Dr. Willey begins the operation through a small incision in the side of the breast, painstakingly detaching breast tissue from the surrounding muscle and skin.
During this procedure, Dr. Willey is using what's called the tumescent approach, adding fluid into the breast during the mastectomy. That fluid contains epinephrine, which helps control bleeding.
Once her part is complete, Dr. Willey will hand off the procedure to Dr. Scott Spear, a plastic surgeon who will perform a reconstruction with tissue expanders. Those expanders will be gradually increased in size and replaced by implants once Caroline's body heals.
So we really do a tag team, all with one trip to the operating room with one anesthetic.
Probably more than 80% of reconstructions today are done immediately at the time of mastectomy. Very convenient for the patient, gets things off to a quicker start.
We catch up with Caroline about 5 weeks after that life-changing surgery, when she has put the early days of post-op recovery behind her. Caroline is back at work near Farragut Square and says the hardest part of healing was emotional, not physical.
But it's hard getting used to, it's like you're grieving. You're losing part of you, and time moves slower when you're recovering.
Caroline looks forward to the day her reconstruction is complete. And she firmly believes having had this surgery now gives her the best chance for a long and less worry-filled life.
I know for my family and my future, this is the best decision for us. It's something we'll never have to think about, and my husband and I can begin our lives together without this hovering over us and never having to look back.
Anita Brickman, WUSA 9.
And join us for our carpet benefit premiere of the movie Decoding Annie Parker, which stars Helen Hunt and profiles the researcher who proved breast cancer can be inherited. It's October 1st at the AFI Movie Theater in Silver Spring, Maryland. You can buy tickets in advance through our website, WUSA9.com. Just scroll to the Buddy Check page under the Features tab.
So brave,
yes.
Like so many women who choose to do this.
It's
so
amazing
brave.
because these are younger women who are finding this out now, having to make a decision for lifelong future.
Wow.